If you're a man over 40, or if you care about someone who is, pay close attention. What starts as a minor annoyance, waking up at night to urinate, struggling with a weak stream, feeling like your bladder never really empties, can quietly grow into a life-altering problem. But here's the good news. You don't have to suffer in silence, and you don't have to blindly accept medications without understanding what truly works best for your body. I'm Dr. Samra, a board-certified urologist, and today we're going to debunk the confusion, explore the latest clinical research, and reveal which medications for BPH not only work, but come with the fewest side effects. With modern science on our side, we're no longer guessing. We're targeting treatment based on precision, safety, and your unique needs. This is a conversation every man should hear, because managing your health starts with understanding it. So I'm going to walk you through the most up-to-date medically supported options for treating benign prostatic hyperplasia, or BPH. We'll focus particularly on medications, especially the ones that science now suggests strike the best balance between efficacy and safety. Welcome to this channel dedicated to men's health. Here you'll find trustworthy, evidence-based, and peer-reviewed information designed to help you take control of your well-being. Because this channel is all about you, I'd love your input. As a urology and men's health expert, my goal is to create content that truly benefits you. So let me know which type of videos you'd like to see more of. Option A, urology-focused topics like erections, prostate health, and bladder issues. Option B, relationships and communication, including trust, intimacy, and anxiety. Option C, lifestyle boosters such as diet, sleep, exercise, and supplements. Or Option D, sexual psychology and techniques, including confidence and intimacy. Share your choice in the comments. Now let's get started on today's topic. Let's begin by understanding what BPH actually is. It's a non-cancerous enlargement of the prostate gland, a walnut-sized organ located just below the bladder in men. As the prostate grows, often as part of the natural aging process, it begins to compress the urethra, the tube responsible for carrying urine out of the body. That leads to a constellation of lower urinary tract symptoms, or LUTS. These commonly include increased urinary frequency, urgency, a weak or intermittent stream, difficulty initiating urination, the persistent sensation of incomplete emptying, and nocturia, frequent nighttime urination. By the age of 50, half of all men will develop an enlarged prostate. By 80, that number rises to over 90%, and a significant proportion will require pharmacological intervention to manage their symptoms effectively. Among the first-line therapeutic strategies are medications known as alpha-1 adrenergic receptor blockers, frequently referred to simply as alpha blockers. Their primary mechanism of action involves the relaxation of smooth muscles in the prostate and bladder neck, reducing resistance to urinary flow and alleviating symptoms. But not all alpha blockers are the same, and understanding which one is most appropriate for a given patient relies on a combination of medical evidence and clinical judgment. Thanks to recent advancements in comparative medicine, we now have robust data to guide those choices. A comprehensive network meta-analysis looked at data compiled from 22 randomized controlled trials encompassing over 3,000 men diagnosed with BPH. This type of analysis allows for the simultaneous comparison of multiple treatment options, even in the absence of direct head-to-head studies. The goal was to determine which alpha blockers work best and with the fewest complications. So why are there so many different types of alpha blockers? The answer lies in receptor subtype specificity. There are multiple alpha-1 receptor subtypes, namely 1A, 1B, and 1D, each distributed differently across tissues. The alpha-1A and 1D receptors are particularly abundant in the prostate and bladder muscles, while 1B is found predominantly in blood vessels. This diversity helps explain the different side effect profiles and therapeutic efficacy of each medication. Medications such as Tamsulosin and Silodosin are known as uroselective alpha blockers because of their high affinity for the alpha-1A and alpha-1D subtypes. Their targeted action improves urinary symptoms with relatively fewer cardiovascular side effects. Another highly selective medication, naftopidol, shows promising results, particularly in targeting alpha-1D, though currently it's only available in Japan. In contrast, medications such as Doxazosin, Terazosin, and Alfuzosin are less selective, affecting both the lower urinary tract and vascular system. As a result, while effective in relieving urinary symptoms, these agents more commonly lead to side effects like dizziness, hypotension, or even fainting, particularly in older adults or those taking other antihypertensives. In the meta-analysis, Tamsulosin 0.4 milligrams was found to be the most effective at reducing symptom severity based on the International Prostate Symptom Score, IPSS. It also demonstrated the greatest impact on post-void residual volume PVR, a critical measure of how much urine remains in the bladder after voiding, improving overall bladder emptying. It had the most significant improvement in urinary flow rate, Qmax, as well. For men who do not respond adequately to Tamsulosin, other agents may offer better relief depending on individual symptoms. For instance, if urine flow rate is the main concern, Terazosin might be a beneficial alternative. If incomplete emptying is more troublesome, Doxazosin could be more effective, albeit with a higher likelihood of side effects. Now, let's talk about those potential side effects, which are equally crucial in guiding treatment decisions. These may include dizziness and lightheadedness, especially when standing, a condition known as orthostatic hypotension, fatigue or shortness of breath, headaches, retrograde ejaculation or reduced ejaculatory volume, a rare condition called floppy iris syndrome, which can complicate cataract surgery, falls, particularly in older adults, due to blood pressure changes. For those especially concerned about ejaculatory side effects, often younger men or those sexually active with partners, Alfuzosin has shown the lowest rate of ejaculatory dysfunction, around 0.6%. In comparison, Silodosin carries up to a 20% risk of retrograde ejaculation. If your patient also has hypertension, the less selective agents might offer a dual benefit. Doxazosin and Terazosin are both FDA approved for treating high blood pressure and BPH. However, as mentioned, this dual action comes at the cost of more vascular side effects. Real-world data from the FDA Adverse Event Reporting System, FAERS, and Medical Expenditure Panel Survey, MEPS, over 7 years demonstrate Doxazosin as having the highest rate of adverse effects, including falls, dizziness, low blood pressure, and fainting. Elderly patients waking up multiple times at night are already at a heightened risk of nighttime falls. Adding a non-selective alpha blocker can compound that risk significantly. In such cases, opting for more uroselective agents like Tamsulosin or Silodosin might be a safer option. Now, let's explore erectile dysfunction and its crosstalk with BPH treatment. In men dealing with both issues, a daily dose of tadalafil, 5 milligrams, the same agent used for erectile dysfunction, may offer a tremendous advantage. Tadalafil is FDA approved for both BPH and ED, making it a convenient dual-purpose therapy. It works through a different mechanism, phosphodiesterase 5 inhibition, which improves blood flow, both to the prostate and penile tissue. Interestingly, naftopetal, though not available in the US, showed a statistically significant improvement in erectile function in preliminary studies, pointing toward its potential vascular benefits. Its unique receptor profile may allow better preservation of sexual function while still reducing urinary symptoms. One smaller study also examined alpha blockers' impacts on cardiometabolic health, even tracking changes in cholesterol, blood pressure, and hemoglobin, A1C, a measure of long-term glucose control. Patients on Doxazosin experienced meaningful reductions across all these parameters, suggesting it may offer ancillary benefits for patients with hypertension, diabetes, or dyslipidemia, but only if they tolerate the medication well. In summary, if you're dealing with BPH, Tamsulosin at 0.4 milligrams and potentially 0.8 milligrams stands out as a solid first choice. It's effective, well-tolerated, and minimally disruptive to daily functioning. However, depending on your individual health profile, whether you're experiencing low ejaculate volume, blood pressure instability, or sexual dysfunction, a different medication might be better suited to your needs. Work closely with your physician to monitor your response, track any side effects, and pivot medication strategies as needed. As always, remember, this is your health. Be informed, ask questions, and advocate for what's right for your body. And finally, If you found this helpful, I encourage you to seek out other reputable medical sources. Stay curious and take an active role in your well-being, because your health matters, and so do you.